and welcome. My name is Andrew Jack from the Financial Times. We helped host alongside the Lancet the commissioning on governing health futures, which was published in October. And the idea now is to really roll out a reflection on the discussions, the insights from the Commission's findings published in the Lancet, and to really engage with policymakers, decision makers, in the health tech sphere, in business, in government, and beyond, to get a sense of the value of the insights, anything that's missing, what the big concerns and issues are coming out of the issues that the Commission has reflected on, and something of a debate around the recommendations that have arisen to see what's feasible, what next steps might be, what, if anything, is missing that we should be drawing into the discussions going forwards. So we have some wonderful panelists to begin our discussion, and we'll talk for the initial period, but I'd encourage you all from now on who are watching to use the chat function for sharing any reflections, and please also use the Q&A to ask any specific questions of both a number of the commissioners that we have here and some other leading experts from business, from government, from the policy world, and so on, so that we can engage a lively debate over the next hour and a half. I'll also post in just a second in the chat some links both to the Commission's website and the Lancet, where you can read the full report, and to the FT, which has been covering and will continue to cover both the Commission's work and the wider issues that it raises. But to start off, I'm going to hand over for a few minutes to Anurag, one of the two co-chairs of the Commission, to lay out a little bit the background, the context, and the recommendations. So Anurag, please, over to you.
Thank you very much, Andrew. It's a pleasure to be here today. And, going from east to west, good evening, good afternoon, good morning. And I hope none of you are deep in the middle of the night. The idea of this commission came to my co-chair, Professor Ilona Ketbush, and myself, along with a variety of funders, looking at how fast the world is changing. And that's why we call it Governing Health Futures 2030, growing up in a digital world. Digital transformation has changed almost every aspect of what we do. And I'm not speaking just about the internet and data. Even the human body is being broken up into digital contexts, and even your genomes are becoming read, write, edit. In that world, for a child growing up, it's going to be a very, very different life from what many of us grew up with. And there are many possible futures in which one could have. Picking the right future, the one that we want, and selecting a path towards that future requires governance. It must be lean, not too heavy-handed, that we block all innovation, yet it must be fair and balanced, so we don't leave people behind and create inequities. So very briefly, when we started this work, we looked for a very diverse set of commissioners, drawn from all over the globe with a diverse set of expertise. Our idea was fundamentally to look at the intersection between artificial intelligence, digital health, universal healthcare. How can you even imagine the healthcare of the future and make sure it is universal, not just thinking of current healthcare delivered in a cheaper and more accessible way, which is very important, but that is not all there is to it. When we broke it down, and when we started this commission, COVID-19 was still some far away, and we were all talking about how soon this digital transformation would come. It came to us much faster than we expected. Many challenges that we had only thought about on paper, we saw in real life happen over the course of the next few years. And to the end, distilling all that work into the recommendations was a tough job. And we had a great secretariat, great commissioners. And finally, I would say, we narrow it down to 4 very major points. The first of them was to point out that health today has digital determinants. What do I mean by that? What I mean is that today your access to digital, your digital literacy can itself become a determinant of your health. That's something very important to recognize because it's not about healthcare delivery. It's about recognizing that your access, your comfort, and the surroundings around you will determine your health in a very digital way. And this must be addressed carefully and equitably to make sure that these determinants are recognized, addressed, and made available in the best possible way all over the world. The second important problem that we saw was that because this area has been entrenched in power with very few companies that control most of the digital backbone of the world, there are growing asymmetries in terms of people's ability to use other people's information. There's also creating a huge sense of mistrust. And especially when you think of the next generation, the young people, we must make sure they can grow up in a trustworthy environment. So our second recommendation was that we must focus on building an architecture of trust. This trust architecture does not mean that we will not share any data. There must be complete privacy. Nobody can touch any data. It simply means that generation of data, use of data, sharing of data must be in manners that are transparent and participatory. People must know what they're getting into, and that's absolutely critical. The other flip side, perhaps, of this particular line of thought was what we saw in the COVID pandemic. Health beyond an individual is also a community concept. Not only must we be assured that our data will be used in trusted and good ways, society must have access to health data in a way that's beneficial to all of us. This solidarity that we refer to in our recommendations as data solidarity is a very important part of the future. And this will require governance, which means we are saying at the same time, and there's no conflict the way I see it, that use of data must be in very trusted formats, but letting data not be used towards bigger purpose is also wrong, which means you need to create agencies and actors that can access data in a way that does not compromise privacy, but that aggregated data is made available to create better health products, to drive innovation and research, to drive understanding that could be critical and country saving in the time of a pandemic. Many of you today who have come to listen to us may perhaps have been hearing about the new variant in South Africa. I co-chair that particular viral evolution group. We are just coming off a very frank and free discussion with South African, our colleagues, talking about this, making it available to the rest of the world. And that brings me to the last and perhaps a very important point. All this is only possible if the fundamental enablers of digital transformation and digital health exist. You cannot build digital health without having a digital life. You cannot build a digital life without having a digital backbone. In India, a country that I come from, a strong amount of investment was required in universal ID, in payment interfaces, before we could move forward. And even before that, you need communication backbones, you need internet. Many of these things can't be solved only by governments looking purely at the health perspective. They would require fundamental investments into the very backbone of the system. They would require partnership with the private sector, but within the terms, within the constraints and boundaries. With the first few recommendations, there must be trust, there must be solidarity, there must be recognition that these digital determinants determine health itself. With that, I will stop here, Andrew, and I'll go back to you so we can have a greater discussion by other panelists on whether our recommendations left something or they would like to build upon them further. Thank you.
Thanks very much, Anurag, and I'll certainly come back to you on some of those points later. But let me do a sort of initial round of reactions, both to Anurag's remarks and, of course, for hopefully those colleagues who've had a chance to go through either the high-level recommendations or some of the deeper insights in the Commission, to get a sense of how far they think it's touched on the key issues, and if there's any in particular that perhaps deserve real focus. And then we'll talk more about some of the recommendations and next steps. Perhaps Wilfred and Jackie, I could start with you, the CEO of Vilgro, and perhaps you want to just very briefly introduce also your organization.
Thank you. Thank you so much, Andrew. Thank you for having me. And I think I agree with Anurag that this is a very important, it's a defining moment for healthcare infrastructure. For me, what popped up was, as we talk about digital health, most of the time we tend to look at the end beneficiary as a patient. But we've seen, as I should have begun by introducing myself by saying that I'm a co-founder and CEO of Vilgro Africa, and we are a business incubator that works with healthcare innovators across East Africa. And most of those, a good number of those are actually in digital health, spanning across Kenya, Uganda, Ethiopia. And what we've learned as we were deploying some of these digital health solutions, it's not just the patient as the end beneficiary, but also we've had clinicians where you look at the clinician as actually the end user. And what we found was the demographic split between the younger clinician and the much older clinicians in how savvy they are in accessing digital technologies. And there's a bit of inequality there where much older clinicians who have been in the field for long enough, even when you put a very powerful technology in front of their hands, most of them would rather stick to their old ways, and then that then trickles down exactly to the end patient that we are talking about today. So there are all those issues around equality of access to digital health, divided by demographic, either by age, by also income levels, I think is another key thing to look at. Internet infrastructure. There are all these other contributing factors that determine how people are accessing and interacting with their digital health. I'll pause there for now and happy to build on the discussion moving forward.
Just one brief thing before I move to others, but in terms of the businesses that you've seen, are we talking largely about perhaps more traditional digital health in terms of the infrastructure for telemedicine, for example, or are you seeing a lot of application and use of, for instance, AI and some of the more sophisticated algorithmic use of patient and medical data?
Right now, it's both, but right now I'm focusing more on the traditional, the digital health as we know it. Of course, knowing that there's emerging technologies like AI, blockchain, which I'll touch on later in this discussion. But starting with what already exists, that's where I'm coming from. And maybe I could highlight one innovation, which I think was very, they approached this in a way that no one else had done it. So the innovation is called Pepa Emr. What that does is that they use a paper-based technology to actually build an electronic medical record. What that means is that they realize that some of these challenges to accessing digital health, including internet and other things, and even the user end user behavior. And they said, if you like to keep scribbling your notes down as a doctor, we'll build a technology that works for you. So basically, they converted WHO guidelines and Kenya-specific Ministry of Health guidelines for managing different diseases like TB, HIV, malaria. And those guidelines were converted into a stamp, so a rubber stamp, which once it's on demand, you can stamp it on a piece of paper. And as the doctor is triaging, there's like a multiple choice question where you shade different shadings as you triage, as you do the tests. And that paper, when you take a photo of that with your normal phone, it pulls out the data and takes it to the cloud and converts it into a digital record. So we've seen that as a way of, I don't know how healthcare is organized elsewhere, but here in Kenya, we have a DHIS2 system, which works from district level upward. But then from district level downward is a black hole. We don't know what happens below that level because they don't have this infrastructure. But using this paper-based technology, then all of a sudden you're opening an immense opportunity to get data all the way from level 1 dispensary upwards, where you can use a very rugged simple technology does the job, which doesn't also require too much of a behavior change. It doesn't require a lot of IT infrastructure. It's basically a rubber stamp that creates an on-demand guideline that you use, and then take a photo of that, and you get all the records on the cloud.
Okay, so yeah, thanks very much, and we'll come back to those issues. Perhaps I'll do a round with some of the business players first, and then come to some of the wider and policy perspectives. Perhaps Pooja Rao, maybe from Curai, would you be able to join us? What are your reflections on the Commission and the importance of the issues that it's tried to highlight?
Yeah, thank you, Andrew. So my name is Pooja Rao. I'm co-founder of a 6-year-old medical imaging AI startup based in Mumbai, India. So I lead research and development of AI algorithms to look at images like X-rays and potentially help clinicians review those X-rays and understand what's wrong with them. So I've taken a look at the report, and I think, in my opinion, the biggest highlight of the report is in its recognition of health data as a common good. And the call that the report puts out in the recommendations to establish this global health data sharing framework, and also the mention of health data trusts and cooperatives. I think this is interesting and timely, and the Commission's acknowledgement of the business model that seeks to extract value from personal data, including health data. I think that's a really timely wake-up call, because the current environment that we have, with a lack of trust in both private actors who will tend to extract value, but also a lack of trust in governments, mostly for privacy, overreach, and cybersecurity concerns, would otherwise prevent the creation of such a shared health data framework. So I really appreciate, for me, that's the biggest takeaway from this report. However, I feel that there could perhaps have been in the report a little bit more emphasis on the individual as the sole owner and caretaker of their data, the recognition of individual rights to own, consent to the use of our data, and perhaps even a right to benefit directly or indirectly from the value being created for society from this health data. For instance, one thing I had hoped to find in the recommendations was a specific mention of health data portability, the idea that individuals can port their health data in and out of health systems, much like we can today do with telephone numbers. I also feel that most recommendations in this report address governments and place very little accountability or emphasis or responsibility, for that matter, on the private sector or at for the public at large, right? So other than as an entity to be regulated, the private sector, or to be protected, which is the individual. So, so I would like to see these two sectors recognized as having more agency and more accountability, responsibility for our actions, to preserve, share, and generate more of this common good. In terms of trends to watch, and I think and nice things and interesting things to keep track of, maybe going forward. One thing that I see coming up quite a lot is more attention towards wearable devices, because I think that this is where digital health is coming for us the fastest. So phones, earbuds, wristwatches. I think the report mentions these as technologies that today track our movements or location, but I think they do much more already. They do heart rate, heart rhythm, respiratory rate, oxygen saturation, and even blood glucose. So this kind of health data is already accessed and monitored daily directly by individuals without really even having an intermediary like a healthcare provider or a hospital, or even really a regulator. So this means that this kind of health data, which is really on the borderline between wellness and fitness and health, potentially has the ability to affect the largest number of people. And also the fact that it's not currently under the purview of regulators means it's perceived as consumer tech, but this is also an area where big tech is really coming in a big way to close this gap, and perhaps bears more watching in terms of digital health, health data, solidarity, and so on. So I'll stop there. Thanks.
Thanks very much. Very, very helpful, Pooja, and particularly that reflection on data sharing and the business models, as well as the responsibilities of government, as well as the private sector. And that's certainly something I'd love to hear other people's views on. Just to say, great to see also some people asking questions, and apart from the general high level of participants we've got here, if anyone has specific questions about the Commission, a reminder that alongside Anurag, we also have here several other commissioners, Dicky Settle and Njide, notably, and I think one or two more who may be joining. So I'd encourage also them to chip in and respond to any of the questions or remarks that those who are watching are making. Let me turn perhaps to Abdullah. You sit both, Abdullah, between, as it were, the academic and research side, but also on the private sector side as well, don't we? So tell us a little bit about your reflections on the way in which the Commission has approached these issues, and any reflections on the recommendations, please.
Thank you, Andrew, for this. And I really want to congratulate the Commission with coming with a great report, strong recommendations that are out there, divided in polls that can be taken into considerations. However, in my opinion, at the end, I feel a little bit two gaps are missing that should be really reflective of how we are feeling it now. We have two level of systems in the literacy now in the healthcare facilities. We cannot consider that the transformations and the recommendation can be solely applied at the same rate, same level, same trends within the systems where I go in countries where we definitely have difficulties identifying individuals. So there are steps that need to be put in place really strongly prior of having a digital health system working properly. So that could be taken into account, and maybe the recommendations will be at two levels based on the categories of advancement associated to countries. I do recognize that in the document they mentioned that the implementation may be solely country relevant, but I think that should be categorized because of those level of access to infrastructure and digital systems. That's the one point. And the other thing is, I think it was really focused on cure and less on preventive. And we know that in the future, we want to maximize the emphasis on preventive. So taking care of wellness, the social behavior actors on making people fit well prior to going to the hospital. So these go beyond the health system by itself. So it required to have the other actors that are beyond the health system to be involved in such recommendations.
That's great. Well, thank you, Abdullah, and yes, and very helpful again. I mean, please, nobody feel that they should only be praising the report, because clearly the next stage now is to really get an honest sense of assessment of what's there, what's missing, what next steps could be. Perhaps I'll turn to Moses Curia from CarePay. Again, you might want to briefly introduce CarePay, Moses, and then tell us what your reflections are on the Commission's work.
Thank you very much, Andrew. CarePay is a health technology company behind MTIBA, and MTIBA is a digital health platform that's driving health inclusion in Africa. We are in Kenya and Nigeria, and we use mobile technology to drive healthcare. Now, I'd also like to commend the commissioners for this report. When you look at some of the recommendations, particularly that strike me, is around creating this digital health ecosystem of trust where data can be shared in a way that is interoperable. And this is important, Andrew, because when you look at the technology trends today, when you talk about AI and machine learning, which is some of the areas where we are in, you only start to unleash the value and the power of that when you have more data that you can be able to look at from a global perspective. From our experience, what we have seen is that you have very many fragmented pools of data that even where there is some form of digitization, you have very many islands. And therefore, when you get these models going, you have a lot of bias within those fragmentations. And the only way to really unlock that is to create this ecosystem of trust where data is shared, where you have interoperability, where people can actually trust not only the patients or the members of the public, but all the stakeholders in that ecosystem, whether you're talking about healthcare providers, whether you're talking about payers, whether you're talking about the participants, everyone is able to have the trust that whatever data is being shared and this pool that is being shared will actually create more value. I think the concept of national health banks, data health banks, I think what I saw in the report, I think is quite timely. If you look at what we've just now gone through and are going through with the pandemic, when the country started sharing data and scientists started and research people started looking at data, then a lot more insights are able to come out. And therefore, the time it takes to learn and implement new initiatives or new interventions gets compressed. And I think this is going to be very profound as we go into the future in terms of how, in terms of implementing healthcare. The last point that I'd like to just make, Andrew, is that I'd also like to see more individual-centric empowerment when it comes to the use of data, when it comes to the realization of the value that is generated and created from that data that is actually shared. And mobile technology today offers a very powerful tool where people can actually be able to actively consent in, consent out, and actually feel that they are in control. And when you look at the adoption of mobile technology, particularly in our countries, in Kenya, for instance, mobile money, which M-Pesa, which some of you might know, rode on the fact that people have mobile technology, and overnight, very many people are actually able to access banking. And this is when we're talking about using the infrastructure, the digital infrastructure that is available in countries. These are some of the examples that we can use. In most countries, mobile technology is there. People have a SIM card, and even where there is no identification, that can be used as an identifier that then is used in that digital ecosystem when you're putting this data together.
Okay, thanks. Yes, that's perfect. Thanks. And we'll certainly come back to you. Perhaps Anne Ertz, perhaps the CEO of the Novartis Foundation, maybe I could turn to you, obviously not only in your own capacity and the work that the foundation has done, but also obviously you've been involved in a number of sort of parallel discussions and processes, I think, haven't you, including with the ITU. So it'd be very interesting to hear your perspective on how this commission sits alongside and what sort of next steps might be.
Thank you, Andrew. And yeah, let me join all the panelists to really congratulate the Commission for a great job. I think it's really laudable recommendations that come up, building this trust ecosystem, data sharing. I can only say that we support that absolutely, totally, and definitely that the accent on reducing the digital divide, because I think that's really the issue we face in the world, and with COVID, it's even become much more in the spotlight, if you may. However, I think if we want to do that, we really have to understand with that beautiful data sharing possibility, what are the real drivers beyond those health inequities? Because we currently don't understand that well. We see that they have increased tremendously, or have become more visible at least, but I think they also increased during the pandemic, but we don't know what really drove that. And definitely not only the health systems. I fully agree with Pooja and Abdullahi, who were mentioning, we need to think much more upfront for the health systems instead of working on the care part. We need to transform our health systems from being these reactive care systems to become proactive, predictive, and ultimately preventive, so that they keep their populations healthy. And that's what data and digital can do best, I believe, in the transformational pathway. But to get that understanding of what are the drivers and what are the underlying determinants we really should look at, we have to combine data from different sectors. And I can tell you, we are trying that currently to understand that together with our partners of Microsoft. And it's not easy. We do it with data-rich cities such as New York City. We're talking to several European cities to bring data from the health sector and other sectors together and see what has been driving these health inequities. And if you want to do that, reasoning over that combined set of data or doing the analytics is already hard enough, as specifically also the majority of the data science capabilities sit with private sector players, and there's a huge need of public sector capability strengthening in data science. But not only that is difficult, it is very difficult to bring data together. And it's beautiful to say we have to have a trustful ecosystem to share data. We are working for 1 full year to get those data agreements more or less figured out. It is hugely difficult. And what governments need is pragmatic guidance on how to do that. For example, in a new working group I just started now with many of you as well in the Broadband Commission for Sustainable Development. We want to see how COVID accelerated the uptake of virtual health services, for example. And we want to see what were the enablers. For some countries, it worked tremendously with a 3,000% increase in virtual services, where other countries were lagging. Even high-income countries were lagging behind because the regulatory and legislative systems were so rigid. But governments are tired of hearing you need to get the right policies in place and the right regulations. They need concrete elements. What are the enablers that made it possible in some countries to massively increase their digital services throughout the pandemic, and other countries were not able. So we are looking at specifically that. And let me end by saying, I think that's something that should really have, could be more emphasized in the Commission, is really this pragmatic guidance of how can countries make sure that if they make policies with concrete guidance, that they think about inclusivity. And one big thing I was missing in the report is in our aging populations around the world, where is the word for the aging population? It's great to put an emphasis on the young and the youth. I love it. But the aging population is the one that is left behind in the digital divide. And that's definitely a very big issue for many countries. And the first ones are the Asian ones. But the next wave is coming for all of the rest of the world. So we have to address that as well, I think.
No, thanks. A very important point about the different types of groups where there's inequity in access as well as potential benefit. But just because you raised that, any particular thoughts on the ways forward? You say you're doing some work around this, and there needs to be in general more reflection on pragmatic guidelines for government. What might be next steps, do you think? What's missing that perhaps this group and others could help to mobilize there to be useful?
Yeah, I think it would be really useful to look at what helps in countries to get a rapid uptake of the right digital health services. What has helped at the level of policymaking, at the level of data interoperability or national frameworks? We know you need visionary leadership and committed financing to make it work at a national level, a digital strategy for health. But we don't know concretely what helps to really have the uptake of virtual services. Maybe we have to look at first cross-border data sharing, because if you want to get access to expertise that is not available in one country and you can access it in another country, why would we double the work? Why wouldn't we rather make that possible, for example? So I think it's really necessary to look at countries that have been successful in scaling up their digital health services to the benefit of the health of their populations, because that's also something we don't often know, whether it does have an outcome that impacts. So I think the work we are now doing, specifically on virtual health and care services in the Broadband Commission new working group, is definitely going to dig deeper on what were the enabling policies and enabling frameworks that made that possible. But that's only for part of the problem. So it should be looked at for digital governance in general, I believe. Andrew, I think examples, good case studies is definitely always useful for many countries.
Okay, thanks very much. If the technology allows me, I see we've been joined by Professor Nasir Sambo from Nigeria. Nasir, could you unmute and join us? Don't know if that'll work. Be very interested to hear your perspective. I know you're very involved. Hello there. You're very involved with the national health system. Hello. Do you want to just briefly introduce your role and any thoughts on the Commission's recommendations?
Okay, thank you very much. Andrew, I have gone through the report and I was fascinated with the content, especially as it relates to having a focus on the healthcare delivery system and trying to recognize the determinant of healthcare in a community with a particular reference to COVID-19 pandemics. The recommendations that came in were very apt, but one thing that needs to be fully understood is the asymmetry in the level of infrastructure between countries, between low-income and middle-income countries, with those countries that are developed. The level of ICT digital technology is still incoming in some of our countries. While in the financial sector, we have gone very far, but in the health sector is still, I would say, rudimentary. So how do we align the activities of the healthcare sector with overarching global focus on digital technology? I think this is very, very important. But to do that, we need to first and foremost try to understand, to take a situation analysis and be able to understand what is currently happening in countries. What are the various activities, digital activities related to health that are being pursued by different countries, so that we can have an articulated document that will guide policymakers in moving from one point to the other. And secondly, we need to also look at the issue of developing critical mass within the healthcare delivery system that can actually serve as champions for this digital revolution that is going on, because we cannot afford to lag behind. The building critical mass and creating champions will entail integrating some of these digital health activities into the curriculum of our training. Because if you look at the training in the low-income countries, the curriculum, sometimes they can stay for a very long time without necessarily being modified. So how do we mainstream digital literacy in our healthcare institutions, universities, school of nursing, other tertiary institutions? Then the issue of investment in the technology. We need to look at all other, apart from the core investment in the technology itself, we need to also look at other infrastructure that will support the seamless implementation of this digital revolution. In a country where power is is an essential commodity and is unstable, you cannot have a very effective digital system working on. So having said all these things, we need to look at the investment within and outside the healthcare delivery system. What are the investment outside the health system that can support? Then another critical issue that we need to do while implementing the digital technology is the issue of change management. There are people That's why I like the contribution of the last speaker, where she alluded to the fact that even the older people need to be integrated. The younger people, they have come during this digital revolution. Therefore, they automatically key into it. But if you look at the policy makers that are driving development in most of the country, is a combination of elderly and people that are maybe above 50 years. So this thing has to factor them so that we can have credible policy that can integrate this digital technology very well. Then in the area of facilitating understanding, how can we have an in-country or a participation whereby countries that are not doing well can study countries that have done well. I can give you an example. We are trying to digitalize the NHI health insurance system in Nigeria. Last few months, I went to Kigali, and I was very fascinated with what I saw. Kigali is a small country, but they have been able to integrate their digital health insurance ecosystem up to the primary healthcare level. And their digital health insurance is interoperable. So these are kind of lessons that other countries that are living far behind can leverage to understand how they can articulate their digital vision and translate it into realities. So by and large, I want to congratulate the Commission for the good work they have done. At least this document has served as a guide, and I hope that more could be done to build on this document so as to have a clear direction as where to go. I think I will stop here. Maybe when we come next, I can shed more light.
Thanks very much. An important point as well, picking up on Anne and others about the value of case studies in practice from different countries where there has been more successful, perhaps uptake or models that could be followed by others. So we talked earlier about some of the issues of privacy and rights and so on. Perhaps this is a good moment to hear from you, Mishi, and your perspective on some of these issues around personal data.
Yes.
No, sorry, Mohammed, I was talking to Mishi. Do you mind going back on mute, please? Because there's a bit of background noise.
Okay.
Thanks very much. Mishi, please.
Great, thank you. Thank you, everyone, for having me, and also the work you all have been doing during the pandemic. I'm joining you right now from Florida. Happy Thanksgiving. I have a law practice in New York and also found a law, tech, and policy organization 13 years ago, which works in India, the Software Freedom Law Center. I will say that if I were writing an aspirational document, I couldn't have written a better document than the one which the Commission has already produced. It captures what an ideal world would look like. But unfortunately, as much as I love it, and I wish this were possible, I am here to also contribute in a way to tell you what I think perhaps it lacks here. But that doesn't take away from the great work it does, as well as the recommendations it makes. So congratulations for all that you have gone through, especially in this time of the public health crisis, which we all have been facing. I'm going to say and echo what Anne and Professor Nasser said. I do not know, I sit in the middle of that ages spectrum, but I do understand that so much of the world population definitely is very young, so I understand the emphasis on it. But the inequality which we are trying to address, and also the health issues which are being faced, I think are in, and the decision makers who are writing this policy until 2030 are not the youth, unfortunately. And they have the right ideas, which is very heartening, But if we are going to actually make this work, then we must concentrate on part of the population which is aging, which is suffering from all of this, and has the issue of access and deep inequality in terms of understanding. I will also say that the document is conspicuous by its absence of, there's no discussion at all about intellectual property rights. If the world's vaccine conversation has taught us anything, it's telling us that no matter how great your intentions are, no matter how much money the global north will put in, things are not going to look equal at all. I am here in the US. I can walk in a pharmacy and get a booster shot, but my family lives in India, who are now, after a very bad wave, now getting to some kind of semblance. But there's so many people in the low and medium income countries who have no access to even basic vaccination. So if we don't talk about intellectual property rights, I don't understand how we actually are addressing the health aspects of it. The third thing I'm going to say is that as much as I like the health data portability part of it, I think it's excellent, it's very important, but I think we have all learned that consent and informed consent is broken. So to talk more and more about consent and informed consent is just going to say, let's make it simple for businesses to run it and governments to pretend that something is going on. That is broken. We've already seen it. We're seeing a lot. The report very well recognizes the fact that a lot of basic issues which are already existing in digital transformation first must be addressed in order for other things to work out. This is misinformation, disinformation, privacy matters, which the large tech companies are already grappling with. So it's antitrust issues. It is about privacy, data collection, as well as content moderation. The report assumes that those would be actually addressed and solved, and then we will be able to do that by 2030. I am a little dubious of the idea that by 2030, all national and local governments should develop, are going to be able to bridge the digital and other kind of gaps which exist. To be very honest, that the report is idealistic in what we would like, and I would love that if all these things could happen, but impractical in operation terms. It's very much based on outcomes, but we do not know the methods how we get to those outcomes. It's great if you live in a country where something like a national health service exists, which is also weekly trying to fend off all these data acquisition things from various private actors, or you already have an infrastructure. It does not work in any other place where people are already having that free at the point of use. Neither in both the countries where I inhabit, which is the US capitalist insurance, multinational company driven health infrastructure, it seems as if we are assuming that in the next 10 years, somehow the large companies as well as the insurance underwriters will disappear and this form of social medicine will be accepted. That I find it very hard to see, because what happened right now, that healthcare systems of the world are emerging from the pandemic, which isn't isn't over, in deeply battered shapes. There is nobody's healthcare system which would have survived substantially undamaged the era of the pandemic, and everybody is trying to rebuild. And there is capital to rebuild on the basis of opposite of exactly what's being discussed in the paper. Until you have data, which is what there are billions of people and whose data needs to be harvested. And that's what most of the health infrastructure people are putting their bets on. How will these healthcare systems rebuild if we take away all that data? There is no proof of sustainability of such a healthcare system, given the current economic realities of the world, including the harm and loss of the damage the pandemic has caused. And that is why it's almost like climate change. Everybody knows that there is what is the level of methane they have to control. The poor countries don't have the money to do it or decarbonize their economies. The rich countries are basically voters aren't with the program. And that's why they are not doing anything. And that's why if we didn't talk about where the money is going to come from to make this happen, as well as how will we get the governments to agree to do this, I think we don't get the outcomes at all. And this is a very ambitious scale. I will say it is overwhelmingly difficult for us to get the governments to do even a tiny thing which is good for their populations. In India, at least a very large population, there is a desire to cure everything through the app economy. First, it was Arogya Setu, then there was COVID app, then there is, I have 3 lawsuits pending in the Supreme Court. I have this entire thing going on where everybody thinks, oh, here is the app, now you should be able to solve everything, but it's just harvesting of the data to the private actors. This is not to take away from all my great clients who are doing great work in terms of bringing new ways of using data to bring solutions to health. But overall, I do find it very hard to believe that healthcare capitalism is just going to disappear. We will do all of these right things, and somehow the big guys are going to say, yeah, this is exactly what we want to do. And the legacy systems will so quickly move on to all of these things. Google bought Fitbit. No matter what the regulators have seen, we've seen what assurances were given to the regulators. We don't even have a privacy law omnibus legislation in the US. India is sitting on it for 4 or 5 years, every time they're dithering about various things. So as much as I want to live in that world, I just don't see how I actually get there at all. But I am going to say it that there is a lot positive there. So it is a little hard to come and make, to say that I can improve anything about what the recommendations are.
No, thank you, Mishi, and really, really helpful, frank views there. I suppose just one question. So, I mean, obviously, you're involved, as you were describing, in terms of perhaps some pushback in the courts against perhaps potential abuse, as it were, on use of personal information, the whole risk of data mining that you raised. Do you see any templates or models out there that could provide a way forward for a more balanced and better governed system around personal data?
I think it was Professor Mohammed who was talking about the fact about the asymmetry in the existing infrastructure. I think that's where it's so important, where the governments want to at least ostensibly be seen to do something to address these issues. But what they do know is that there is no budget out there or even a very deep understanding. So they understandably rely on private actors. And the private actors are saying, well, data is the biggest thing which we require from all of it. And it is a lot of, whether it is precision medicine, whether it is about the new products which is being developed, that's the ecosystem they have actually cut their teeth on. So that's why it seems so much more attractive to only go in that area and just say, this is how we are going to do it. I will say this is that there are certain emerging aspects which the report does allude to and talk about, more transparency, open source infrastructure, which is now becoming some very basic stuff about it. But I am not seeing any interesting stuff which is coming out in terms of actually managing the sensitive personal information of people. In that some of it, what is happening is SSI, some privacy by design, and some venture capitalist money is going in those yes/no inferences, or in the ways how we manage this information. Those are the only interesting cutting edge stuff I have seen where the money is going. But the governments are mostly saying, here is an app, we did it, don't bug us, and here is the data for the personal actors. This is Singapore, very early on in March, came up with a great app which actually provided the template for many other apps for contact tracing. And even Singapore later on said, oh, you know what, here is all this data we've collected, now we are going to use it for solving crimes. So when that happens, or GED match happens, or you see genealogy, you constantly worry. I wish that the commission was running these governments, but that's, or the ministries of health, but that's but that's another utopia, and that doesn't happen at all. And I'm not saying, I've always been, as a lawyer for companies who build such products, and as an investor in such companies, I always believe that a lot more change is brought by businesses and not by governments or civil society. Civil society is the moral conscience for everybody, but the changes are definitely brought by the private sector. And I think that we have to nudge them in those directions far more. This is a very ambitious agenda. It makes the right recommendations, but I unfortunately don't see many of these outcomes happening unless we actually emphasize on what the methods are. So I would say maybe it is better to be not as ambitious and try to concentrate on fewer things, but I want this paper to be out and for everyone to be reading it.
Thanks very much. And yes, I mean, going back to your Singapore example, very striking here in the UK, for example, where the COVID testing companies authorized by the British government for travel abroad now seem to be hoovering up that data for wider genetic insights, which is deeply worrying. So kind of on the one hand, voracious private, but also, you know, frankly, to put it in the most optimistic light, naive governments in permitting that wider use of data, which risks undermining public trust, including for the short-term purpose of COVID responsibilities. But let me move. Apologies for all everyone who's been very patient. Tobias Silberzahn, who's been a very good friend and helpful partner, including on outreach to the private sector around the reflections on the Commission at McKinsey. Tobias, any reflections you've got on some of the findings and the recommendations of the Commission?
Hello, Andrew, and good to see many familiar faces, and great to see how this whole topic moved on from the first day when the Commission started in Berlin a few years ago. Maybe just a quick intro. I wear a few hats, and you know, on the one hand, I help health tech businesses and healthcare businesses be successful. On the other hand, what Andrew just alluded, I host the Global Health Tech Network and CEO Roundtable, which is then a bit more than 1,000 digital health startups. But today, I actually want to wear a third hat, and that is from a person who leads a health and well-being program for employees in my own company. And you know, wearing all three hats, I love the three things out of this report in particular. First of all, this mission-based, values-based thinking that the report instills. Then secondly, that digital as a determinant of health and well-being. And thirdly, the notion that governance is needed. If I now sort of quote you, Anne, with the point about pragmatism and the point about concreteness, right? I now put on the hat of a person who runs a health and well-being program for a few thousand employees, right? Which many of them are quite young, but you know, you wouldn't qualify them as teenagers, I guess, but they are, you know, a bit below 30. So if we take such a cohort for a moment and split it into two, there are some people that are medically seen as healthy, and then there are some that have some sort of disease, right? And I love for us, and maybe the Commission, if I may suggest it, to think about what is the benefit that those people actually want, right? Because that's the primary thing why anything would work or not, right? So if I simplify a bit, the people in my health and well-being program that are medically healthy, they have one benefit that they are interested in a happier, healthier life and staying healthy. And then the people who have some sort of disease, it doesn't really matter what, they are interested in something that helps them manage their disease in a better way. That's the two fundamental benefits that they are looking for. And then there are different ways how I can provide as a person who runs such a health and well-being program to them. It needs to be fun, it needs to be convenient, and it needs to be effective. And if it's not fun and if it's not convenient, then it's not going to work. And you know, and of course, effective is sort of a boundary condition, because otherwise we are wasting everyone's time. So if I think about something that is fun, that is convenient, and that is effective in terms of health and well-being, right? And maybe now I'm too pragmatic and too concrete, right? most of what we are talking about happens on mobile phones, right? And if I think about health and well-being, especially for young people on a mobile phone, right, then, and yes, I'm simplifying now, there are 6 things that are really disproportionately creating benefits. There are things around sleep, there are things around nutrition, there are things around fitness, there are things around mindset, stress management, positive psychology, or whatever we want to call it. There is the underlying data layer, and that there are some wearables that some people like or not. These 6 elements usually are in some shape or form on some phones or not, right? And if I now bring it back to the governance topic that comes up in the report, right, a key change then would be in my home country now, Germany, to say, how do we want to, among those 6 things that happen on the mobile phone of young people or not so young people, how is the data between those 6 things shared, right? And as a person who runs such a health and well-being program, I've got about 50 to 100 of those offerings on my phone, and they are not talking to each other very well at all, right? So the wearables don't fit with the sleep stuff, and then the nutrition stuff doesn't fit with someone else, and then there is sort of the health record on my phone, and that doesn't work with most of the things, and it makes it neither fun nor convenient nor effective, right? So in that sense, if I can sort of encourage one thought, right, is like sort of what would that actually be looking like, and actually just doing it, right? And with just doing it, I mean, how would a curriculum for a school look like? How would a curriculum for maybe a company look like to make this fun, convenient, and effective? Right, and I think COVID is a brilliant example, and that's the last thing I say, I promise, Andrew. COVID is a brilliant example how not to do it, right? If I just think about benefits, being a citizen, right, what I would love with COVID is all things that are possible, but no one, at least to my knowledge, is doing them. If I'm affected today, I would love to have a website where I can then enter my age and my weight and my preconditions to then get a prediction of how likely is it that I will have complications on day 8, 9, 10, 11, or 12 of the infection, right? And then ideally, I would love to have a little check mark where I can say, do you want to be part of a remote patient monitoring program for COVID, so that somewhere a doctor can be watching over you and you can measure your oxygen saturation 3 times a day. And then if complications kick in on day 9, then I'm actually contacted and someone is sending me some sort of, dexamethasone or whatever medication, that I can take this medication within 3 hours of the oxygen saturation dropping. And of course, then there will be some doctor or nurse watching over me, because I shouldn't do that over the counter. It is about as difficult to do that from a technical perspective as booking a table at a restaurant, but no one is actually doing it. There are loads of people talking about what might be done or what could be done, but I haven't seen, and maybe that's just my sort of lack of knowledge, I haven't seen anyone who has built such a website that actually creates, and that's then my final word again, a pragmatic benefit for people.
Yeah, thank you. A very, very good point on, yes, the way perhaps there's still a rather top-down approach to how we're rolling out technology in the context of COVID. So thanks for that, Tobias. I think we've done the first round of, as it were, the external participants providing feedback. Please, anybody, shout if you want to come in or send a message. But perhaps I might go to one or two of the other commissioners who are present for any further reflections they've had, both on what people have said or their own sort of reflections on perhaps next stages and what's more required post publishing the findings and the recommendations. And Jide, would you like to come in?
Yes, thank you, Jack, and thank you to all the participants who have spoken. I think quite a number of the points that have been raised were actually debated within the Commission, so they are not alien to us. You can see that already the scope of the discussion is widening, I think that we have to, first of all, take a stand, because we know that, as Professor Sambo mentioned, there's a wide asymmetry, first of all, between the young people and the old people, of which, if you look at the low-income countries and the high-income countries, there's almost a reverse situation. So Africa, for example, has a huge population of young people, while the developed country has a huge population of older people. You look at the digital divide, the same thing applies. The low-income countries has a huge digital divide where a lot of people are not connected. So, first of all, the question is, how do you balance the recommendations such that it's meaningful to all the different parties and the different countries that are going to look at the report? But first of all, agreeing on some fundamentals. One, data being a determinant of health. Two, the need to share data, not to extract data, but the need to exchange data for public good, to build this data solidarity that can help improve the system. Three is, what are the governing principles? Yes, we know private sector is playing a huge role, but who is governing them? How is the government, which is really, if we're going to achieve universal health coverage, the government has to be in the driving seat and bringing everybody together. So we've looked at all of this, and I can give you an example that in Africa, the private sector is actually the ones driving in terms of innovation, in terms of, connecting people. So there are pockets of excellence, but someone needs to develop the governing principles, and it has to be government. So quite a number of the things that have been mentioned have been deliberated on, but we have to have a starting point. And again, I must say thank you so much to Professor Sambo, who, by the way, has a very critical role. He is in charge of the National Health Insurance Scheme of Nigeria, which I would say is 200 million people. So if he manages to pull this off, then at least we'll have a template for all of Africa, because we have similar issues in terms of connectivity, young people, and so on and so forth. So I must say thank you, quite a number of valid points, but let's take this report as the baseline, where we're going to start off from, and then we can then build on that. So back to you, Jack.
Thanks very much, Njide. Delighted to see also that Ambassador Gill, Amandeep Gill, who was also one of the commissioners, has now joined us. I don't know, Amandeep, perhaps you might want to come in here. We were discussing earlier, amongst other things, a lot around this question of the governance, including data trusts as a model going forwards, and how that might work to balance the public interest with the private interest, as it were. And I know IDEA, one of the organizations you're involved with, has been quite involved in looking at models. Any thoughts you have on that, and perhaps ways forward, templates maybe of interest?
Thank you very much, Andrew, and my apologies. I was on a panel, the Canadian Science Policy Conference, just before this. I think that's a great question. So how do we shift the conversation on data? And can data trusts, data fiduciaries, if you will, be an enabler of that shift? I think the larger context is that we are in a data protection paradigm today. That's very important. Privacy, security, making sure data is not misused. And a lot of that is being driven by regulatory initiatives, EU GDPR and some of the follow-on initiatives. But then eventually, for that kind of trust to be there in digital health and AI for health, we need to move to a data empowerment paradigm, where the citizen is at the center of these data flows, has more agency over the choices around their data. I think both governments and the private sector would need to adjust to this shift. Now, governments would have their role, and the private sector would have to come up with more sophisticated models than today's consent management model. Trust, the role they can play. You have good examples. In the UK, for example, there is this in genomics, several other areas, you have created authorities that hold data in trust for researchers, public health officials who want to get insights out of it for the greater public good. Estonia and others Finland are moving in the direction of legislation there. And there is space also for non-profits, international platforms such as the International Digital Health and AI Research Collaborative, to aggregate, confederate researchers and curate the problems, the data sets, and some of the AI solution and the benchmarks around that, so that we get away from this beggar thy neighbor, let me hoard data and create great value out of it, not realizing that you're undermining value for everyone. So just the beginning of a transformation, and the Commission's report comes in at a right time to contribute, to weigh in on this shift.
Okay, thanks very much. Maybe another Commissioner, Dicky from PATH, do you want to come in with any reflections on the sort of ideas that we've heard raised and the feedback thus far?
Yes, thanks, Andrew. And really, thank you. This has been really just the most exciting panel for me. Along with Mishi, we're kicking off our Black Fridays here in the US, coming together to have this conversation. This is the first time I've had the opportunity to hear such a wealth of both enthusiasm for and also criticisms of the report. And after being really head down with Anurag and Jide, Amandeep and others for 2 years, really deeply working on this report, this is really powerful to hear these voices, particularly in reflection to what we put out there. And I think first, in response to some of the very good criticisms, Mishi, Ann, and others, I want to set a little bit of an understanding of what the report's intended to be, because some of your criticisms pointed directly at that. And the report was not intended to not only set the targets and the vision, but also to lay out the entire roadmap of how to get there. The sheer word count of the report offered to us by Lancet would have precluded us even beginning to get to that level. What we did recognize in the report is where, if we take, for example, climate change, a really good analogy brought up, I believe, by you, Mishi, we didn't have the same kind of targets that we can really rally legislators and decision makers and politicians around. We didn't really have the same kinds of aspects governing digital transformation, and really guardrails and language that can help us navigate this digital transformation, because realistically it's inevitable. It's happening. And there are such tremendous risks of digital, instead of alleviating the challenges we're seeing in health inequities, exacerbating them by adding the digital divide to those challenges. And so we really wanted to leverage, and thank you, Andrew, for joining with the Lancet in this, to leverage the brands of Lancet and the Financial Times and the best minds that the Commission was able to pull together to try to help set this common language, these targets, and really give us something to reach for. And then to begin to ask ourselves the questions, how do we get there? What is that practical path? As Mishi said, it sounds like a lovely world, and one I'm certain you already agreed with and we're already aligned on. But there are so many others, particularly, again, those legislators, members of the G20, politicians who did not have that same common ground. So it was really our goal of the report to help lay that common ground and then galvanize us for exactly these kinds of conversations to begin to lay out those practical steps and begin to think about how to get there. I threw up the background for Digital Health Week. You haven't missed it. It starts next week. It's being championed by the Transform Health Coalition, which I'm very proud to co-chair and having Jide and others be part of. And this Transform Health Coalition was designed and built in parallel with the commission, the Lancet FT Commission, to help address exactly these questions, to advocate for the recommendations, and work with good minds and thinkers and the real practical folks to really help build that forward. So I'll throw a link in the chat for the Digital Health Week. It's an amazing agenda of some 50 events across many countries. We're only anticipating 10 for the inaugural Digital Health Week, but we've got 50, and we hope that these conversations will really happen and begin to help us build towards the practical roadmap to achieve this world that I think we all would like to live in, and begin to address specifically these challenges. If I might, Andrew, just address a couple of those.
Sure.
There was a really good call out of the youth versus age divide. And, you're exactly right, the burden of disease is felt by older people. The digital gap is felt most strongly by older people, but also a lot of the political power is in the hands of older people. And that's really where we wanted to focus with the report, is to try to not so much say, let's focus on the youth to the exclusion of the elderly, but how can we foster a partnership and encourage older folks with that power to engage more digital native, the youth of the country, than the innovation that's going to be necessary to transform. And so that's what we really wanted to lay a foundation for, advocating for, and addressing in the report. Another fantastic call out, Mishi, was the intellectual property gap. And you are right, as we were finalizing the report, that emerged as such a strong issue around the vaccines and sharing that property and really unlocking innovation for equitable access around the world. Amandeep, I'm so glad you're able to join us. Some of the work that you're doing in IDAR to really create greater equity in the knowledge making around the world is, I think, really going to help us address that. But realistically, this really in the cycle of the development of the report, those issues emerged for us a little bit late. You will find us addressing some intellectual property around digital public goods. Where we were really focusing on was the inequities of intellectual property and where is the digital technology being made and supported. And that's where we were leaning in with the report, even as this new tremendously important issue was emerging around the equity of intellectual property around technology. Andrew, I don't want to take up too much airtime, so I'll stop there and allow my colleagues to have additional reflections.
No, that's really helpful. Thank you. And I think also probably as a central coordinating place, also the Commission website, Governing Health Futures, might be a good place for people to continue to look at for not just Digital Health Week, but a number of other initiatives and ideas to follow up, including around some youth panels in the coming months. But perhaps just for a final round of reflections, and perhaps very briefly, but I wonder particularly if some of the external partners here might be interested in just throwing forward, we've obviously the Commission in its formal sense has come to an end. There's now a kind of process of consultation and rollout and engagement and some ideas for follow-up. But I wonder if any of you had any, if you had each a single recommendation of how to perhaps build on or supplement some of the insights and the recommendations from the Commission. So tapping into either the individuals and organizations that were involved around them, or some of the other parallel initiatives that you're involved with or aware of that could really kind of drive the agenda to precisely go from the ideal, as Mishi was saying, towards actually practice and implementation. I don't know whether, Mishi, if you had a very brief thought, a couple of sentences.
Sorry, I was answering Jude's great point about AI and ethics in the chat right now. So, which was an excellent point about the fact that I think that there's so much discussion about AI, and unfortunately our in Europe, all we can get is regulators, not many companies. And so much of the capitalistic money is in the US, and US is coming kind of, or pretending to come at the end of the laissez-faire approach it has had with everybody's data, but nothing will happen in this administration until the midterm elections happen next year. And then maybe if Biden-Harris come back, and there is China, and I think we're, at least in the large part of where the world lives, which is the global south, the majority world, I think that mostly we are being told that this is excellent, this is great, you put the AI and machine learning buzzwords into something and magic would happen. It is excellent actually in a lot of ways, but not in the VC buzzword way. I'm very grateful for what Tiki said in terms of addressing and what we were trying to do, and then galvanize behind this. I will say again that this is great, but if we were to perhaps concentrate our energies on maybe one or two things, and then make them the ones which we are aiming for, then it becomes much more realistic in 2030 than say, I want the entire world. I would like it. I just am also enough of a pragmatist, and having worked with governments around the world, as well as companies as their lawyers, I don't think that's happening. So that's my one recommendation.
Okay, thanks very much. And yes, I see an important point here raised by Njide about the monopolization concerns of big tech. I don't know whether, Wilfred, that's something you might like to come back on, or any other final reflection on, kind of how the policy debate at least ought to move forward, and perhaps trying to bring together the private with the public sector. Yeah, actually, that was me on the chat. I don't know how I was renamed to Njide when I was... Okay. So you asked the question. How would you reply? So I think what we've seen is, as we work with smaller startups here, we keep seeing a lot of big tech from Global North coming and making acquisitions here. And I think the solution will be around the biggest challenge, bottleneck we have is around data sovereignty, where you cannot host healthcare data outside your jurisdiction. So if you are generating healthcare data in Kenya, you need to host it here, which is a hindrance for smaller startups to attain scale, right? You can't build an Africa-wide infrastructure. You'd have to buy 54 servers plus, which for a small startup is very difficult. So I think we can adopt some. I've seen EU come up with harmonization around healthcare data, where anywhere within EU you can share across countries. I think borrowing or following up or at the back of the AFCTA agreement that we've signed as a continent, we should bring to the forefront this issue of around health data, or just data in general, because in the AFC Africa Free Trade Area Agreement, we're just looking at movement of goods and services, but we haven't talked about movement of data, which I think it's more, data is likely to move even faster than goods and services within the continent. I think that's a discussion to pick up with AU, especially for us who are in digital health, and see how we can take that agenda forward. The other thing is around readiness, which was raised many times, the digital transformation readiness framework, which I think we need to locally contextualize it, because what that would mean for a developed country is different from what it would mean for a small country that is growing, that barely has good internet and all. So how do we make do with what we have? Can that framework be locally contextualized? And going back to what Professor was saying, how do you even now, as you train, you start integrating this from the training, from the nursing colleges to the medical colleges, and as you skill, as you train, it becomes a new way of treatment. Because what happens at Wilcro, when you introduce something new and put it in the hands of the nurse, they say, this is not how we were taught in medical school. And there's always immediate pushback. So that can be embedded in the teaching pedagogy with the whole digital health aspect to it. I would like to rest there, and thank you so much again. Great work for the commissioners, and happy to provide more insights moving forward. Thanks, Wilfred. I see a couple of very interesting other points raised here in the chat, including Andrew Farlow at Oxford, who's been doing some very interesting work around AI, talking about the costs, particularly of long-term data storage, and how that often drives then obviously to companies and away from governments, and what could be done to try to make this whole sector more competitive. I don't know, Moses, do you have any thoughts on that?
I think my parting shot, Andrew, is that sometimes we let the best become the enemy of the good. We all see the value that digital transformations can do, not only in health. We've seen the impact in other industries, particularly in Kenya, in the financial services and so on. And sometimes not all the conditions will be perfect and present. We just have to make the steps forward using the existing infrastructure, the existing technology, and that might mean different things for a country like Kenya compared to Estonia, and so on. So I think that's something that we need to take into account. When it comes to cloud hosting, data storage, what Wilfred was talking about, data sovereignty and all that, I think it's really important to focus more on not where the data is, but is this data secure? Who's using it? Who's responsible? What are the privacy considerations around it, and so on? because we've seen, you know, with cloud hosting, we've seen how it has reduced the cost and how that has, you know, opened up the space. So I think it's good to be very practical and pragmatic, and not wait that everything has to follow a certain structure or everything has to be present. So thanks, and lastly, thanks to the commissioners for this. And I look forward to seeing some of these recommendations actually going into policy, particularly with governments.
With your help. Abdullah, maybe any final recommendation or challenge, if you like, perhaps back to the commissioners on what next steps could be?
I agree with Moses. We all hope that some of the recommendations come to policy, and there is a real important issue that the Commission will face also, because in all this digitalization, we didn't talk about all the fight on climate change affecting digital sector. So there might be at least some lines in the report talking about digitalizing in a way that we are in emphasizing the fight on climate change, not digitalizing for digitalizing sectors, but making smart move in the directions of having a healthcare system that is resilient, inclusive, but respecting the fighting regarding climate change.
Okay, thanks very much. Pooja.
I have one point, which is that I was very interested in the idea of data cooperatives. I've also heard about the data trust, but I think the way that trust is structured, it says something about a top-down government authority, while a data cooperative to me says a more community-led, community-owned, where the value goes back to the community. So I would really love to see an example of how such a data cooperative might be structured and might function. I also want to talk about the world of Web3. I don't know if it's been talked about in this context, but Web3 is this emerging community-led sort of counter narrative to big tech, centralized platforms, data extraction, and not necessarily in health tech, but elsewhere in this whole world of Web3, we have examples of data cooperatives for things like automobile data, to maybe train self-driving cars, where the interests are generally the same. We don't want private actors to be able to extract all the value from data that everybody creates. I know this is very different from health data, but I would still like to see some examples of ways in which we could learn from Web3, learn from existing data cooperative models that exist, if only to have something to more concretely criticize and learn from the next time we speak about this.
No, thanks very much. And I agree, it goes back to that question about case studies of practice. So around data trust, it would be very interesting to understand the experience so far. Anne, any final thought or challenge to the Commission and what might come next, knowing the other groups, the Broadband Commission and others that you're involved with?
I very much liked all the comments now, and specifically the role of localization. I think local data are the most important if you want to come to inclusive solutions. It has to be based on relevant data. So local data, local innovations are much more powerful, and those that use the local infrastructure, such as you were referring to, Moses, I believe, or someone else, but I think that is really essential. We've seen that only those that do build on local infrastructure and on what is feasible locally do get to scale. And just for that reason, in fact, I want to mention that next week, on Thursday, we are launching the biggest physical health tech hub in Africa, in Kigali, together with Norsken Foundation and the Novartis Foundation, hosting a health tech hub for over 30 startups will be selected for the first prize, but can be hosted then in that Norsken house of East Africa for further development of their solution. And we go for innovators that have already a solution that is validated and just need stronger plans to bring it to market at large scale. But I also wanted to give the info that there's maybe a parallel to do. I fully understand that starting in the Commission on Youth and what can be driven by youth, I'm fully supportive of that. And the link to elderly can definitely be made by building intergenerational societies. And that's how we see the society moving forward from now to 2050, for example, with the Commission on Healthy Longevity of the US National Academies of Medicine. And I would recommend you have a look at that because we are finalizing that report with the US National Academies as well. And lastly, one big data collaborative is being set up for cardiovascular population health with Accenture and ourselves at the Novartis Foundation. It's a heavy delivery to set up such a collaboration. Different partners, researchers, private sectors, governments can contribute data or other exchangeables or expertise, a not-for-profit data collaborative for bringing better understanding of how cardiovascular population health can be handled. So that is something we will make available, how it's set up and what it needs to get such data agreements and sharing and combined analytics done. Will all be shared openly online as soon as it's finalized. And I hope that will be in the first half of 2022.
Thanks very much, Alan. If you have a minute to put any links into the chat here on the Kigali Data Hub and the other initiatives, do please do that. Okay. And I see also Amandik has cited an example of My Data in Switzerland as a model for data trusts. People might be interested in looking at. Other examples would be very welcome. And Dickie also talked about this consultation period that's still open around health data governance principles. So do feel free to look at that and we'll circulate those links afterwards. Tobias, one final challenge, and then perhaps I'll come back to Anurag to wrap up.
I guess if one final sentence, I would love to see what you would invite a city that is driving a health and well-being program like Amsterdam or Greater Manchester. What would you like them to do based on your report? Right. Secondly, what would you, let's say a Ministry of Health, what would you invite them to do, the three things based on your report? And then finally, what would you like to a mobile phone company, right, who reaches a lot of the young people? What would you like a mobile phone company to do as a first step, right? Completely in the spirit that you mentioned, Moses, of you know, getting started, being pragmatic and moving the important stakeholder forward.
No, great thought. It would be really interesting if a next step could be a sort of sandbox to test out some of the principles with some willing partners like Amsterdam, as you mentioned. Well, I hope people could take that back. I apologize if we're, you know, I want to be respectful of everybody's time, but so perhaps, you know, sorry if anyone's not had time to say any final things. Do put any links into the, as Anne just has, into the chat. That would be helpful and we'll circulate. But Anurag, perhaps you want to wrap up with any final reflections on the points made and thoughts on next steps from the point of view of the Commission.
Thank you, Andrew. And I mean, thanks to all the wonderful panelists who gave the wonderful critiques that I fully accept. To be honest, many of the thoughts that you mentioned came through our minds and we had two choices: to err on the side of being too idealistic or to err on the side of being too pragmatic, to err on the side of setting very high bars or to err on the side of being prescriptive in ways that may apply to one ministry and one telecom company, but not to another. So between various possible errors, we chose the ones that we thought would set high standards, but provoke debate and follow up. We hope it's not the end of the Commission, and follow up with actual interventions that can be done. And everything that you people have said is going to become part of what we learn and take forward. Thank you so much.
Thank you all so much. Thank you, Anurag, for wrapping up. Thank you all the commissioners for joining, and all our external participants, some really helpful and useful ideas and thoughts. And I hope we can all sort of build and connect and try to sort of drive forward these aspirations and those of others for their for the greater good. But thanks all for coming now. Bye-bye. Thank you.
Thank you. Have a nice weekend, everyone.
Thanks a lot.
Thank you, Amity.
Thank you. Bye.
Thanks. Bye.
Bye all.
Bye all.